everyone. So February is National Children's Dental Health Month. So we wanted to take a moment to revisit the importance of establishing good oral habits in children. So many of you may not know this, but baby teeth are actually formed at 4 to 6 months gestational age. So before you ever even meet your baby, their teeth are forming. And this is why it's so important for mamas to keep their oral health in optimal conditions throughout their pregnancy, as the bacteria that cause cavities can be transferred from the mom to the baby. Pregnancy hormones also cause gingival inflammation and bleeding of the gums. Morning sickness and acid reflux can also pose a lot of wear on your teeth. So if you are expecting, do come in and see us. We would love to follow up with you and make sure everything is nice and healthy for you and baby. So baby teeth do serve a very important purpose. They help with speech, and they also help save the space for the permanent teeth. And so it's very important to keep baby teeth in place for as long as possible. We highly encourage parents to bring their children in by the time that their first tooth erupts or by their first birthday. So there are definitely some things that you can be doing at home to help maintain optimal health for your children. You can get a little bit of water on a washcloth and gently massage your baby's gums to keep them healthy. And then as they get a little bit older, we encourage you to get in a routine of helping them brush their teeth twice a day with just a tiny little bit of fluoridated toothpaste on a soft bristled toothbrush. Dental caries is actually the most common chronic illness in children. And so this year's focus was actually regarding fluoride and the positive impact that fluoride in the water has had in reducing the prevalence of cavities in children. So whenever we see children for their cleaning appointments, we definitely encourage them to have fluoride placed as a preventive measure in helping keep the enamel strong and healthy. But other alternatives can also be like xylitol. It is a substance that can help stimulate salivary flow, and it helps to buffer the acids in your mouth. And so if they're old enough, xylitol mints, gum, they even have xylitol toothpaste. That's also a good alternative. We do place sealants on newly erupted permanent molars as a preventive measure as well. So we encourage you to bring your children into our practice, as we love to see kids and they really brighten up our day. Another thing is be very mindful and make sure you are not putting your baby to bed with a bottle. Baby bottle tooth decay is very prevalent. You want to make sure you wipe their gums before they go to sleep, as we talked about earlier, and only give them water in a bottle at bedtime. Definitely no milk. And then a few other things. So vitamin D, studies have shown, can actually help decrease the incidence of cavities. So make sure you get your sunshine. And there's certain foods that can also buffer the acids in the mouth. And these are different dairy products, cheeses, yogurts, salmon, tuna, and apples. So these are all great foods to incorporate into your child's diet. Whenever your children come in, we do a tell, show, do method where we tell them what we're going to do, show them what we're going to do, and then we follow through with whatever we have planned for that day. And we definitely like to get them acclimated and make them feel very comfortable when they're here. And we like to make sure that you are happy as well as their caregiver. So yes, it's National Children's Dental Health Month, and we hope that you enjoyed these tips.